How does brain imaging reveal CFS brain fog? Have you ever wondered how brain imaging can help us understand the brain fog experienced by people with chronic fatigue syndrome? Brain fog is a common symptom of this condition, and it can significantly impact daily life. Recent advances in brain imaging techniques have shed light on the underlying mechanisms of this cognitive challenge. Brain imaging reveals that the brain fog in chronic fatigue syndrome is linked to both structural and functional changes in the brain. Techniques such as magnetic resonance imaging, functional magnetic resonance imaging, and positron emission tomography have shown notable differences in the brains of individuals with chronic fatigue syndrome compared to those without the condition. One of the key findings from these studies is the presence of structural brain changes. For instance, magnetic resonance imaging has identified reduced white matter volume in certain areas of the brain. This reduction suggests that the connections between different brain regions may be altered, which could contribute to the cognitive difficulties experienced by patients. Specifically, abnormalities have been observed in areas like the right arcuate fasciculus, which is crucial for communication between brain regions. In addition to structural changes, brain imaging also reveals altered brain activation patterns. Functional magnetic resonance imaging studies indicate that individuals with chronic fatigue syndrome often need to activate more areas of the brain to perform mental tasks. This increased activation implies that their brains are working harder and less efficiently, which can lead to feelings of mental fatigue and brain fog. Furthermore, decreases in cerebral blood flow have been noted, particularly during activities that require standing. This impaired blood flow may contribute to difficulties with attention and memory. Another important aspect is the role of neuroinflammation. Emerging studies using combined positron emission tomography and magnetic resonance imaging are exploring how inflammation in the brain may affect cognitive function. Activation of glial cells, which are immune cells in the brain, has been linked to brain fog symptoms. This inflammation can disrupt normal brain function and may correlate with the severity of cognitive challenges. Research has also highlighted reduced function in brain areas related to fatigue perception. Studies from the National Institutes of Health have shown that the right temporal parietal region, which is important for recognizing fatigue and motivating effort, exhibits reduced activation in patients with chronic fatigue syndrome. This diminished response may explain why individuals experience profound fatigue and cognitive difficulties when attempting mentally demanding tasks. In summary, brain imaging provides valuable insights into the cognitive symptoms associated with chronic fatigue syndrome. These imaging studies show that brain fog is not just a subjective experience. It has identifiable neurological correlates. Understanding these changes helps validate the challenges faced by individuals with chronic fatigue syndrome and emphasizes the complexity of brain dysfunction beyond mere fatigue. However, it is essential to remember that while brain imaging offers important information, no single imaging test can definitively diagnose chronic fatigue syndrome. Clinical diagnosis still relies on symptom criteria and the exclusion of other conditions. Always consult healthcare professionals for personalized medical advice.